Good morning and welcome to Teen Health Connection's 30th anniversary celebration. I'm Libby Seyfert, Executive Director of Teen Health Connection. We are so excited to share this very special day with all of you. And we have so many reasons to celebrate all that's been accomplished over the last 3 decades. While we had hoped to mark this milestone occasion in person, out of an abundance of caution, we're coming to you virtually from our offices off Randolph Road, where we are all safely distanced. We are truly humbled and grateful for you, our supporters. Thanks to you, our team of adolescent experts have helped to transform the lives of tens of thousands of teens, empowering them to be healthy adults. And we are also grateful for those who saw the tremendous need for better access to health care. For teens in the mid-80s, they fought for 7 years to make Teen Health Connection a reality on February 25th, 1992. Our Mecklenburg County Commission brought together 48 community leaders, along with both hospitals and members of the Healthy Charlotte Alliance, the Junior League, and so many more. Thank you! And a very special shout out to Atrium Health, who has been with us from the very start, and whose support allows us to do what we do best, care for teens and their families. Since its inception, Teen Health Connection has led the way in establishing best practices and advancing research to meet the needs of teens and their families. We're one of a kind. There is no other healthcare practice like us in the entire region. And here's another fact that I'm especially proud of. There are only about 400 board-certified adolescent medicine physicians in the entire United States. And 2 of them are right here at Teen Health Connection. Dr. Shamika Dixon is Chief of Adolescent Medicine and the Director for the Center for Gender Health. She joins us to share more about how Teen Health Connection has grown and evolved to address the whole teen in today's complicated world. Dr. Dixon, why did you choose to dedicate yourself to the health of adolescents? And why is Teen Health Connection so important to our community?
I chose to dedicate my life to adolescent medicine because I come from adolescent parents. I feel like my career was predestined. I take care of young people at their most vulnerable time, at their most exciting time, where they're developing into the people they are going to be one day. So at our practice, we care for 11 to 25-year-olds. In this time in life, you get to try on so many different hats and practice who you want to be without actually committing to it. I love that we help to guide those young adolescents safely, successfully, without judgment to adulthood. And if I had to pick what I'm most proud of, I think what I typically tell people, because we provide an array of support, an array of treatments, is that we serve diverse populations. So I mentioned we take care of patients 11 to 25. They come from all walks of life, all family backgrounds, belief, race, ethnicity, socioeconomic classes. I love that. What I tell people when I teach about adolescent medicine is that no matter where you come from, right, during this time period, you still need support. It is a hard time, especially nowadays, right? And so they need all the support and love. I love that we take care of so many different patients and we meet them where they are. We help to give the families the support they need so they can better communicate with their children, so they can help them along this journey. I am most proud of that.
You're kind of stuck. You're treated like a kid, and then you're also treated like an adult.
But teenagers have always had unique problems. Mecklenburg County leaders in the late 1980s decided to do something about it.
This was the health department, the junior league, the medical alliance, and then everyone finally decided, hey, this is what teens need. They need a comprehensive look at health. They need something that looks at the whole person.
30 years ago, Teen Health Connections' focus on the whole person was so unique and forward-thinking, it was recognized by the President of the United States.
I spend an enormous amount of my time, as you might imagine, trying to do things that I believe will help our country meet the challenges we face today so that young people will have a better future. A whole lot more of you will have successful lives as a result of this place.
From a small office on Elizabeth Avenue with a leaky roof, cast-off furniture, and temperamental plumbing, Teen Health Connection grew to meet new challenges, serving more teens, saving more lives, finding new, impactful ways to serve the underserved.
1998 is when I got to join the team. It's been almost 24 years. And that was a game changer for me, and I think for Teen Health Connection too. Because as a psychologist, I really got that, and here we were working together. So Dr. J would see a patient. Perhaps this kid was dieting, and the mom was concerned. We thought that we needed a nutritionist. Dr. J would say, Libby Cleveland, come on in room 7. And there I would go. And guess what? This kid was depressed. He wasn't eating because he was suicidal. Literally, we have been saving lives for 30 years.
The beautiful thing is you may come for one thing, you come for your physical, and where there is a need, whether that be mental health or reproductive health, we connect you to those services. Our goal is to treat the whole adolescent.
Through the years, people continued to recognize Teen Health Connection's unique, comprehensive mission, like famous Hornet starter Muggsy Bogues and the Surgeon General of the United States, David Satcher. Over the last 30 years, the core teen challenges have not changed, but social media has made some intensify.
Social media and the image that you see of other people around you and how you're supposed to look. I know of teens that are cyberbullied and have to move schools. It's tough because of this image that you're trying to create. They're just trying to create an image of being better than one another, and it's kind of negative.
Teen Health Connection sponsored The Big Picture, a play written and performed by Mecklenburg County teenagers. It reached thousands every year with messages about disease prevention and healthy lifestyles. It tackles all the hard topics.
I've ruined the lives of 2 of my best friends. Allison is dead.
From eating disorders to suicide to peer pressure and dating violence, The Big Picture tells the truth, providing guidance and good common sense.
I think that The Big Picture is really meaningful and compelling and powerful, and part of what makes it particularly effective is these are the teens' words. There are data to back it up, and so it's a medium that really works in terms of kids hearing and also parents and adults listening.
The adolescent, in many ways, I think of as sort of the canary in the mine. In other words, we look at the adolescent, and whatever is happening with the adolescent, you better wake up, because that's what's happening to your culture.
Teenagers, they're remarkable. They're amazing human beings. So not only do they have these challenges, but man, do they rise above, and they do so much for our community. So, in honor of Dr. Johnston and Barbara Ziegler, we began a merit-based scholarship for a local teen who was exuding the same characteristics of leadership and care for their community.
We really have a number of teenagers that are achieving, that are doing great things, that are volunteering, that are showing leadership, and that are advocating for good things in our community.
I think it is important to recognize young people because so many times we look at them and we see all the faults that they have, and we don't spend the time to look at those who are the leaders, the ones that stand out and do something special.
Leadership is important because you get the opportunity to grow yourself. You get to learn who you truly are and how you function. And if you learn that about yourself, you're able to extend that to other people.
Teen Health Connection is working every day to improve the lives of every teenager.
We also sponsor the Teen Advisory Board. Our staff and volunteers develop and empower teens to prevent underage drinking and drug abuse. We offer parenting classes and coaching to parents of teens as well as teen parents.
Libby has been a wonderful steward of this whole program. I mean, it has expanded. I mean, Barbara and I don't even recognize the place. It's been so successful with all the care.
Last fall, we launched our Teens and Tots program, which cares for the adolescent parent and the baby simultaneously for the first 18 months. We have expanded our Center for Gender Health. That has grown in the last 2 years 200%. We have increased the amount of mental health services we're providing to treat depression and anxiety, in addition to starting other things like HIV pre-exposure prophylaxis.
When COVID hit, Teen Health Connection responded with virtual care and expanded behavioral health services.
I will definitely say these last 2 years we have seen increasing numbers of emergency psychiatric needs, suicidal ideation, loneliness, and depression.
Teen Health Connection has been pivoting since 1992. We have looked hard and long at the challenges our teens have and grown both in our teammates, our staff, our supporters, our volunteers. We know that by making a difference with these teens today, we have an impact as they get older.
You belong here. You belong with me. Everything's clear if you choose to see.
Just like the Surgeon General says, we've got to address the teens' needs now because those needs are our future.
It's amazing what your love can do.
Wow. Just think of the impact Teen Health Connection services and programs have made on the lives of so many young people during our first 30 years. The first group of teens are now successful adults giving back to their community. Just imagine what the next 30 years will mean for us. Our next guest has seen many of those teens grow up. In fact, Jane Llewellyn's own daughter was one of our very first Teen Advisory Board members. From our humble beginnings in a small building off Elizabeth Avenue, Jane rolled up her sleeves and helped paint the walls to today serving as Teen Health Connection's board president. Jane has been a steadfast supporter from day one.
I am so very proud of this organization and how it has grown and the resiliency that has been within. The issues our teens faced in 1992, yes, they were challenges, but through the past 30 years, they've grown even more intense. And through the strong leadership, our teammates, our supporters, and everyone in our community, we've met those challenges and we will continue to meet those challenges. Teen Health Connection is here for our teens, and our ability to pivot with their needs is what I'm most proud of. We're here because we are moving and changing with our teens. We are here because our teens need us, and we will continue to be here. And that is truly what makes my heart warm and what makes me so very proud to have painted those walls and to be in the right place in 1992 so that I could be involved and I could witness firsthand the evolution of this organization.
Jane, I cannot thank you enough for all you've done, and to our many volunteers and donors who have made Teen Health Connection what we are today. Our rich history and meaningful mission would not be possible without all of you. It is an investment in a young person's life and in our community's future. We had a very generous donor start our 30th anniversary campaign with a $30,000 donation in honor of our founders, Barbara Ziegler and Dr. John Johnston. Wow, big wow. We are already off to such a strong start. I'm so excited to tell Dr. J and Barbara, who are joining us by video, just how much we've already raised so far. The donations are still coming. Drum roll, please. And that number keeps growing and growing.
I really want to thank our dedicated, our wonderful donors. I mean, without the donors, we would not have Teen Health Connection. Teen Health Connection depends on all of you being so generous, and we appreciate it. Our adolescents appreciate it. Our staff appreciates it. We love you and thank you.
I don't know how to begin to thank you all for your generosity. You've given so much and you continue to give. And as we celebrate our 30th anniversary, it's just, my heart is so full. I don't know how I can even thank you enough for supporting us all these years and all the joy and the happiness and the good health that you bring to so many teens in this community. I thank you, thank you, thank you.
Thanks, Barbara and Dr. J. I hope all of you watching now will join me to help fund Teen Health Connection's services and programs. Every donation makes a difference, large or small. Your tax-deductible gift is a direct investment in the health and well-being of our teens. To donate, simply click here. Together, 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 we can do it. If you'd like to learn more about Teen Health Connection's programs, go to our website, teenhealthconnection.org. Thank you all so very much for joining us today to celebrate our Big 3-0, 30 years of serving this community.